Forward.
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 Putting our foot down and moving forward with women's reproductive rights.
We need to stand up for our constitutional rights.
Moving reproductive rights and healthcare forward.
Moving forward guarantees women the rights to make their own decisions regarding their bodies.
No matter where they live, all women deserve full access to healthcare and reproductive rights.
Ensuring every woman access to affordable contraception, education, and quality healthcare.
Women's reproductive health is a personal issue that has become highly public.
In order to gain a better understanding, all women must have more knowledge concerning what reproductive health truly is.
A state of complete physical, mental, and social well-being deals with the reproductive processes, functions, and systems at all ages of life. Reproductive health implies that all people can have a satisfying and safe sex life and that they have the capability to reproduce and the freedom to decide if, when, and how often to do so.
Most people see reproductive rights as only the basic rights women have for their health. They do not realize everything that is involved.
In order to obtain the changes necessary for future development, we all must understand the foundation of what women's reproductive health truly is.
It starts with the understanding of a fulfilling relationship, opportunity to have a desired child, and to avoid unwanted pregnancies.
Reproductive health has been a widely discussed topic for many years.
Throughout time, there has been a shift in the idea of families and health compared to past generations. Today, most women want 2 to 4 children, fewer than in past generations.
This is due to the increased availability of contraceptives and women's control over their own bodies.
The United States is failing to provide equal access to reproductive health care based on race, color, and ethnicity.
Women of color fare worse than white women in every aspect of reproductive health.
While most would think that women's reproductive rights covers all women, they are sadly mistaken. There is a huge gap in reproductive health for women due to race.
African American women die in pregnancy or childbirth at a rate of 3 to 4 times that of white women.
There are other issues that are also prominent according to race. Infant mortality rates are drastically higher for women of color.
Women of color are seen to be irresponsible and unreliable, therefore encouraged by doctors to do longer-lasting birth control methods and sterilization. There is a huge difference in how doctors handle situations with patients due to their race. In society, it is common for a doctor to take precautions with white women when it comes to sterilization and abortions. They typically insist that they do not have the procedure done that day, and instead come back a second time so they have adequate time to think about it. However, when it comes to a doctor's attitude towards women of color, it is drastically different. Doctors are more apt to complete the procedure that day without recommending adequate time to think about their decision.
What are women's reproductive rights?
Contraception methods have greatly evolved throughout history. These pictures are an evolution of the methods since the beginning, which started with women drinking mercury and lead. A second factor that contributes to women's reproductive rights is abortion.
Abortions have been performed for thousands of years since the time of the earliest settlers.
They used to be extremely risky and dangerous. As time went on, medical practice began to flourish and become safer.
In the mid-1800s, states began to pass laws making abortions illegal.
By 1910, all but one state had criminalized abortions except where necessary, resulting in women having back alley abortions.
Abortion became legal again in 1973, granting women the option to obtain safe abortions.
Hi, are you here for your abortion appointment today?
Yep.
Name, please?
Rachel Kist.
Okay, I just need you to fill out this paperwork. Perfect. Right through the door.
Thank you.
There are approximately 1.21 million abortions each year. This makes that 1/3 of all American women by age 45 will have had at least one abortion. Less than 1% of all abortions take place because of rape or incest.
The third factor to women's reproductive rights is access to quality health care.
Women should have the right to safe and quality health care at a reasonable cost, whether that be contraceptives, prenatal care, or annual checkups.
The right to quality health care has deteriorated into an attack on the character of women who want nothing more than to have a personal decision in the matter.
In order to give women the rights they deserve, they need to have access to not only quality health care, but health care that is also affordable.
In order for all these topics to come into effect, the fourth factor, education, must be present.
In order for women to make good choices regarding their health, they need to have access to education to gain the information they need.
Overall, women who have access to education can gain better jobs to pay for quality health care. And with education about reproduction and contraception, they can make better and healthier choices for themselves.
We need you to lead the whole country forward on reproductive rights.
Let's do this, everybody.
Which way are we moving?
Forward!